My husband is a travel nurse anesthetist, and our family of six travels with him. I believe we do a pretty good job managing healthcare expenses while at home and on the road. For potential travel nurses or other travel healthcare providers, healthcare expenses on the road can be a major concern. I suggest you start with totaling up all that you and your family have spent on healthcare this past year. This includes your family's premiums for health insurance, eye insurance, and dental insurance, as well as the copays and the money you spent towards deductibles. You can likely log into your health insurance account and look at all of your explanation of benefits to see how much you were responsible to pay. And then, of course, don't forget to add in your actual premiums to that amount. Your family could have easily spent more than mine. Instead of health insurance, my family are members of Samaritan's Ministry Health Share. This is only for unexpected health expenses. With this health share, we are self-pay when visiting any clinic or hospital. That means we don't present a card when receiving health care. We are simply reimbursed for qualifying expenses according to the guidelines, which means there are no networks to mess with. We pay out of pocket for eye and dental issues. Here is what we spent last year total for all of our health care. Here is our 2023 healthcare expenses. The total was less than $12,000 for a family of six. We have three in the family who go every year to the optometrist and purchase new glasses. We purchase them through Zini online, so it is much cheaper than at the actual optometrist office. And there's our number for that. Next up, we have the dentist. We do not have dental insurance, nor do we have eye insurance. So this is just what we pay out of pocket. This is all of our medical expenses that we had in 2023. That's it. And then this is our health share. I'm just going to reiterate, our health share is simply to help us when we have unexpected health care expenses. If you look at that number, you can compare that number to what you're paying in insurance to see if you think that would be a good fit. This is for our entire family. It comes out to about $642 a month. Then if you look at all of our healthcare expenses, it's less than $12,000. The average for what we pay for everything a month would be $964. And that's it. Now, this is a breakdown specifically for our actual medical expenses. This is all of the medical expenses we had last year. All of our children did go for pediatric well visits. Two of my children do not wear glasses, and here at this office, they have the equipment to do a basic eye exam. So that's what they're doing instead of going to the optometrist. Unless there's an issue, then they will start seeing an optometrist yearly. So for the urgent care, the telehealth urgent care, generally it's just sick visits. We've had some sinus infections, just stuff like that. And that was for 8 of them. We've been using Sesame Care for those visits because we can use that in any state. We just pick a provider that's licensed in that particular state, and we can do that from the comfort of our own home, and it is much cheaper than going to a brick and mortar urgent care. As you can see, we had 4 where we actually went to urgent care, and 2 of those were because I pulled something in my back. And then one of my kids' his neck just swelled up. It was concerning. He could breathe, but They just said it was something to do with an infection in his lymph nodes, and they didn't even do anything for him. Thankfully, that went down. He was just fine after that. And then my other child had a double ear infection, and I wanted somebody to actually look into her ears to make sure and get her antibiotics for that. And then this is for, yeah, that was for one of the telehealth urgent care. It was a refill for that medication. And then this 5 medications for sickness were for the other times we visited some sort of urgent care and the kids were prescribed like antibiotics. And then this is mainly my medications. I have high blood pressure and chronic headaches. So that's my medication for that for the whole year. And then the specialist, my husband went to see somebody about his back. He's been in some pain from an old injury. Then for my blood work, I have to have tests done every so often for my blood pressure medications. But the bulk of this was actually my husband had been having some symptoms and he had a few things that he wanted to check out. So we used Ulta Labs and he ordered the labs that he wanted and went to Quest and got all that checked out. So everything came back normal, which was good. So just to reiterate, we're self-pay, and this is all that we spent this entire year on medical expenses. Please don't let the fear of the lack of health insurance options stand in your way of beginning or continuing a travel healthcare career. There are private health insurance options, which you can check out through a health insurance broker. I do not recommend using healthcare.gov if you travel most of the time, as it will only cover you in what they deem emergencies outside of your home state. And in your state, your options could be very limited with the providers that will take that insurance. If you found this video informative, please like and subscribe to be alerted when a new video is available.